Are you looking to stop breastfeeding and dry up your breast milk supply? There are various methods you can try, from going cold turkey to using hormonal medications, sage tea, cabbage leaves, and more. We will explore 9 effective methods to dry up breast milk, as well as 3 methods to avoid. We will also discuss how long it takes to dry up breast milk, possible side effects, and alternative options. Stay tuned to learn more. Why would someone want to dry up breast milk? There are various reasons why a breastfeeding parent might choose to dry up their breast milk, including personal, medical, and practical considerations. Some may be weaning their baby, while others could be facing challenges in their breastfeeding journey, such as low milk supply or health issues that require medical intervention under the guidance of a healthcare provider. Returning to work can be a common scenario where a parent decides to dry up their breast milk due to the challenges of pumping and maintaining a milk supply while being away from their baby for extended periods. Significant discomfort like sore nipples or frequent clogged ducts might lead to the decision to wean off breastfeeding. Following a recommendation from a healthcare provider can be crucial in situations where a parent's health conditions necessitate stopping breastfeeding to focus on their own well-being or undergo a specific treatment that is not compatible with breastfeeding. Methods to dry up breast milk. There are multiple methods available for drying up breast milk, ranging from natural remedies to medical interventions. Each method can vary in terms of effectiveness and comfort, and it's advisable to consult with a lactation specialist or healthcare provider before starting any method. Cold turkey. The cold turkey method refers to abruptly stopping breastfeeding, which can often lead to engorgement and other uncomfortable symptoms as the body rapidly adjusts to the sudden reduction in demand for breast milk. Engorgement is a common challenge faced by both the baby and the breastfeeding parent when opting for the cold turkey approach. For the baby, this sudden change can be distressing as they are abruptly denied the familiar comfort of nursing. The parent may experience physical discomfort, including painful swelling and potential infection. The emotional impact of ending the breastfeeding relationship abruptly can lead to feelings of guilt and sadness. This method can disrupt the hormonal balance in the parent's body, potentially leading to mood swings and feelings of emptiness. It is essential to consider the psychological effects on both the baby and the parent when deciding to stop breastfeeding abruptly. Hormonal medications. Hormonal medications can be used to suppress lactation by altering the body's natural hormone levels, and these are typically prescribed by a healthcare provider to ensure safety and efficacy. There are several types of hormonal medications that are commonly used for lactation suppression, including estrogen-based medications and progesterone-based medications. Estrogen works by inhibiting milk production in the breasts, while progesterone helps to reduce breast engorgement. These medications are designed to mimic the hormonal changes that occur during pregnancy and breastfeeding, tricking the body into thinking it does not need to produce milk. It is important to consult a healthcare provider before starting any hormonal medication for lactation suppression. Your provider can assess your individual health needs, discuss potential side effects, and monitor your progress to ensure the medication is working effectively without causing harm. Sage tea. Sage tea is a popular herbal option for reducing milk supply, as it contains natural compounds that can help to gradually suppress lactation when consumed regularly over a period. During the weaning process, incorporating sage tea into the diet can aid in the natural reduction of milk production. To prepare sage tea, simply steep a teaspoon of dried sage leaves in a cup of hot water for about 5 to 10 minutes. It is recommended to start with a small dosage and gradually increase as needed. While sage tea is well known for its potential to decrease milk supply, other herbal options like peppermint, parsley, and jasmine may also have similar effects. These herbs can be consumed in various forms, such as teas or tinctures, to support the weaning process. Cabbage leaves. Using cabbage leaves as a natural remedy for lactation suppression is a method that can provide relief from engorgement and discomfort, as the leaves have cooling and anti-inflammatory properties that help reduce milk production. To use cabbage leaves for lactation suppression, simply place chilled cabbage leaves inside your bra against your breasts. The coolness and properties of the leaves can help soothe the engorged tissue and reduce swelling. It is recommended to change the cabbage leaves every couple of hours to ensure they stay fresh and effective. Some women find this method highly effective in managing their milk supply and alleviating discomfort. Ice packs. Ice packs can be an effective way to manage discomfort and reduce breast engorgement when attempting to dry up breast milk, as the cold temperature helps to constrict blood vessels and decrease milk supply. When using ice packs, it is recommended to apply them for about 15 to 20 minutes at a time, several times a day. Be sure to place a cloth or thin towel between the ice pack and your skin to prevent frostbite. This method not only helps in relieving pain and swelling but also promotes comfort by numbing the area. Reducing engorgement through ice pack therapy can make it easier for your body to adjust to producing less milk, thereby enhancing the weaning process significantly. Tight bras. Wearing a tight bra can help to suppress milk supply by providing constant pressure on the breasts, which signals the body to reduce lactation. While wearing a tight bra seems to have an impact on milk supply reduction, it is important to consider the comfort of the individual wearing it. The pressure exerted by the bra should be sufficient to send signals to the body without causing undue discomfort or pain. To avoid any potential negative consequences, it's crucial not to compromise the health of breast tissue. It is essential to strike a balance between effectively suppressing milk supply and ensuring the well-being of the wearer. Peppermint oil. Peppermint oil is another herbal option that can be applied topically or consumed in small amounts to help reduce milk supply and aid in the drying up process. When using peppermint oil topically, it's essential to dilute it with a carrier oil like coconut or olive oil to prevent skin irritation. A patch test is recommended before widespread application to check for any adverse reactions. For internal consumption, only a few drops should be added to water or tea. Pregnant women, breastfeeding mothers, and children should consult a healthcare professional before using peppermint oil. In terms of effectiveness, peppermint oil is known for its soothing properties and is often preferred over other herbal options for its quick relief of discomfort. Like any herbal remedy, it may not work for everyone, so it's essential to monitor its effects on an individual basis. Herbal supplements. Why? Herbal supplements, such as peppermint oil, are commonly utilized as natural lactation suppressants to aid in decreasing milk production during the weaning phase. These herbal remedies function by impeding lactation through the reduction of prolactin production, the hormone responsible for milk synthesis. Peppermint oil, specifically, is historically recognized for its desiccating properties on the mammary glands. Employ peppermint oil for the purpose of drying up breast milk, it should be administered topically to the breast subsequent to dilution with a carrier oil. It is imperative to acknowledge that while herbal supplements can effectively reduce milk supply, caution must be exercised and their usage should be supervised by a healthcare professional. Sudafed. Sudafed, a common decongestant, can also be used off-label for lactation suppression by affecting milk production through its impact on the body's hormone levels. When using Sudafed for lactation suppression, it is crucial to consult a healthcare provider for guidance on dosage and frequency. Typically, the recommended dose ranges from 60 to 120 mg every 4 to 6 hours, not exceeding 240 mg in 24 hours. It's important to note that the use of Sudafed in this manner should be temporary and closely monitored by a healthcare professional. Since Sudafed can have potential side effects and interactions with other medications or existing health conditions, seeking medical advice is paramount to ensure safe and effective use for lactation suppression. Methods to avoid when trying to dry up breast milk. When attempting to dry up breast milk, certain methods should be avoided as they can stimulate milk production and prolong the breastfeeding journey, which can be counterproductive. Pumping or expressing milk. Pumping or expressing milk can actually increase milk supply, as it stimulates the breasts to produce more milk in response to the demand. This can be counterproductive when trying to dry up milk supply, as the body interprets the frequent removal of milk as a signal to continue production. While there are situations where expressing might be necessary for comfort or medical reasons, it is important to minimize this practice to avoid maintaining or even increasing milk supply. Gradually reducing expressing sessions can help signal the body to decrease milk production naturally over time. Warm compresses. While warm compresses can provide temporary relief from engorgement, they can also encourage continued lactation by increasing blood flow to the breasts. Although the immediate soothing effect of warm compresses on swollen breasts is undeniable, the risk of inadvertently stimulating milk production in the long run is a concern for many nursing mothers. While it may feel comforting to apply warmth to relieve pain and pressure, it is essential to be mindful of the potential consequences of prolonged use. Using warm compresses excessively can lead to an overproduction of milk, exacerbating engorgement rather than resolving it. To manage discomfort without promoting further milk production, alternatives like cold compresses, gentle massage, and proper breast support are recommended. These methods can help alleviate engorgement without the risk of prolonging lactation. Maintaining good breastfeeding techniques and seeking professional lactation advice can also be beneficial for managing engorgement without relying solely on warm compresses. Breastfeeding or stimulating nipples.
Continuing to breastfeed or stimulating the nipples through activities such as massage or certain clothing can signal the body to keep producing milk, thus hindering the drying up process.
It is essential to understand that nipple stimulation can lead to the maintenance of milk supply, even when trying to transition to weaning. This continuous signaling confuses the body into thinking it needs to produce milk, ultimately prolonging the weaning process. Tips to prevent accidental stimulation during weaning include avoiding tight-fitting clothing that may cause friction, being mindful during intimate moments or showers, and opting for gentle breast care routines. By taking these precautions, mothers can effectively support the natural decline in milk supply during the weaning journey. How long does it take to dry up breast milk? The time it takes to dry up breast milk can vary widely among individuals, often depending on factors such as how gradually the process is undertaken and the initial milk supply, but it typically ranges from a few days to several weeks. Individual differences play a crucial role in this process. Factors like overall health, age, and hormone levels can impact the duration. The chosen method for stopping milk production influences the timeline. For instance, weaning gradually by reducing feeding sessions and pumping less frequently may extend the duration but can be gentler on the body. Consulting a healthcare provider is essential as they can provide personalized advice based on your specific circumstances, ensuring a safe and effective transition. What are the possible side effects of drying up breast milk? Drying up breast milk can lead to potential side effects such as breast engorgement, mastitis, and fever, all of which may require medical attention and, in some cases, antibiotics to manage symptoms effectively. When experiencing breast engorgement, the breasts feel swollen, firm, and tender. This may be accompanied by a feeling of heaviness or warmth. Mastitis, on the other hand, presents with symptoms like redness, swelling, and pain in the breast, often accompanied by fever and flu-like symptoms. Fever itself can be a common side effect, signaling an infection that needs prompt attention. To manage these symptoms, applying warm compresses, gentle massage, and expressing milk can help ease breast engorgement. For mastitis, antibiotics prescribed by a healthcare provider may be necessary to clear the infection. If symptoms persist or worsen, seeking medical help is essential to prevent complications. What are the alternatives to drying up breast milk? If drying up breast milk isn't an option or desirable, alternatives such as introducing formula or gradually weaning to solid foods can be explored under the guidance of a healthcare provider to ensure the baby continues to receive adequate nutrition. Introducing formula may be necessary in cases where breast milk drying up is not the preferred route. It's important to choose a formula that matches the baby's nutritional needs and consult with a healthcare provider for guidance on the best way to introduce it. Transitioning to solid foods can also be a gradual process that ensures the baby receives essential nutrients. Consulting with a healthcare provider about the appropriate timing and types of solid foods for the baby's age and development stage is crucial to maintain a balanced diet.